balance system is like our sixth sense. Once you don't have balance, sometimes you really don't have the perception of the self. So when we think about the balance problem, we always categorize them in medicine into two categories. One, we call them peripheral, meaning that they affect the inner ear, or we call them central, when it has to do with the brain. And the reason why I'm giving you this distinction is because when we talk about longevity, sometimes we forget that, as every other system, also the vestibular system deteriorates. And it deteriorates in a sense that, again, it's not just one system. It's the muscles, it's your inner ear, it's the way you move your head and neck. And when it deteriorates and this integration of multisensory integration fails, you, of course, become more prone to falls. And this is why, sadly, we have such a high rate of elderly that have a risk of falling. And just to give you some number, 1 in 3 adults over 65 experience a fall. And as you know, when an elderly sadly falls, then sometimes they have hip injuries, they can hit their head, they can have concussions, and they can have all sorts of problems. So this is not just a problem for them, it becomes a problem for your family member. Perhaps you had some of your relatives, your mom, some of your grandmothers having this, and it's a big burden financially because risk of falling is huge and it happens, and sadly it leads to a high rate of mortality. Now, why I'm telling you about this is not just because we have falls, we also have patients that are much younger, that they also have a burden of dizziness and vestibular problem. And at the moment, the current standard of care for, let's say, balance problem is not optimal. We see, especially in my field, so many patients that they go from one specialist to another, to another, to another, and we see that there is a lack of understanding that because the balance system is so complex, as I mentioned to you before, we need an holistic approach. So this is kind of why we need to look at it with different eyes. The other things I'd like to share with you is that, sadly, most of the dizzy patients that we see are females, and there is an hormonal problem that is often not considered. Just to give you some idea, patients, they go from 10 to maybe 20 doctors before receiving the right diagnosis sometimes. And also we have a huge number everywhere in the world, in the US, even in the UAE. So I decided to, after my PhD, when I got so many patients coming, to create an app that looked into the holistic approach to balance problems. And we created and founded Bequalise. We are a platform that helps patients that suffer from dizziness. And what we do is that we put together a recovery plan looking at the patients with a holistic approach. So we look at the way they eat, the way they sleep, at everything like mindfulness, movement, to try to help them with a 360 degrees approach. Now, dive into the things I mentioned before. We have so many more women that sadly struggle with balance problem, and that's why also in the company we decided to consider the gender difference that these patients have. This is a paper that I've published 2 years ago, and I'm trying to push in my field the fact that we need to look at specific gender medicine for balance problem because it really changes the way patients are treated. So in the current standard of care, when you go to an ENT or neurologist, if you come to one of us, we don't really have the time to take into account hormones, your genetic profile, or really to have a look at the patient with 360 degrees approach. But this is very important, and I'll give you some information since there are so many more women in this room than men, and it might be interesting for you to know. So hormones are influencing everything, also our balance system. And this is quite recent that we figured out this, because despite we know that females are very different from men, in my field, in this specific area of medicine, we're only now starting to understand how important it is to consider hormones. Why? Because the proprioceptors of, the receptor for estrogens and progesterones are basically spread all over the brain. And what happens is that whenever we have menses, hormonal fluctuation, we enter menopause, the way we integrate information also changes. So if you are a female and you are going through a vestibular migraine attack, for example, you have dizziness, it's very likely that you might have dizziness when you are your period. And that's why it's so important to consider gender. I give you, maybe some of you, they suffer from motion sickness, I don't know. Motion sickness is much, much more prevalent in women, and especially in women when we travel, or we are in a boat, in a car, or whatever, and we have our period. Once again, highlighting the importance to consider hormones. Another condition that perhaps your mom or your grandmother or some of you that you may know knows is BPPV, benign paroxysmal proximal vertigo. This is the most diagnosed conditions in my field. And to give you an idea, I don't want to be too specific and too medical, but it's a condition that causes very intense vertigo. When the patients start vomiting, they're very dizzy. And it might happen to any of you at home. What happens is that in the inner ear, we have otoconia. They detach when you are entering menopause and if you develop osteopenia, osteoporosis. And again, there is a link with the female. So we see so many more women. Why? Because they enter menopause, they become having osteopenia, osteoporosis, and then they develop this condition. And this is why I'm trying to push more and more in my field the need to look at the patient with 360 degrees approach and not just treat them for the condition, but also understanding why this is happening. Because the patient is probably getting older and developing osteoporosis. So we try to look at the patient as a 360 degrees. We also know from studies that when patients taking hormone replacement therapy, for example, they have less incidence of dizziness, especially of BPV, because they have less osteopenia. So once again, going back to looking at the patient as a whole. Another disease that characterizes my field is called Meniere disease. I don't know if you have heard of it. It's a condition that sadly some people develop as a genetic component. And again, we've proved that when we look at the hormones, patients feel better when they take certain specific estrogen because you also reduce the fluid that is attributed to the pathophysiology of Meniere disease. Now, when we look at central disorders, so as I mentioned before, not at the inner ear, but at the brain, once again, it becomes very important to consider hormones. I don't know if any of you has migraine in the room. Many of you may have it. Migraine is very common, and vestibular migraine is a subgroup of migraine. And we have, just in the UAE, 1 million people suffering from vestibular migraine. Is extremely common, and is extremely common in females. And again, hormones plays a role, so we need to look at the person as a whole. And when we look at hormones, we know that, for example, if you have migraine, they always get worse when you're about to approach your period. Why? Because estrogen gets low. So this is just an example of how important it is to really look at a person as a whole and not to just look at one specialty. Now, in the app and in the job, in our platform, and what we provide to our patients is that we try to push the holistic approach. One of the first things that is usually very, very good for those patients is to change their diet. Why? Because when you have a migraine and you have a sensibility to certain food, if you eat certain food, you increase your histamine, and then you have more migraine attacks. So it's very good to first suggest also changes in lifestyle. This conference is all about lifestyle, and probably all of you are very passionate about it, and I really hope that it's going to be more and more integrated because it can really help the patients and help everybody to live a better life without abusing and without diminishing the need for medication. So again, in this talk, I just wanted to give you some idea of how complex is our balance system and how important it is to push for an holistic approach. Holistic approach that we promoted through Bequalise, looking at every aspect, also the emotional aspect. And again, a 360 degrees approach with psychological support, education, that is very important. When you know what you have, you already feel better and reassured. So we try to promote that. Now, why vestibular, and especially the balance system, is so important and related to longevity? So one of the main things is because the vestibular system is, of course, related to cognition, and sometimes is not really overlooked. So when all of us will become older, we think about other things, but we don't think about our cognition and our brain, how to keep it healthy. And actually, balance is one way to keep it very healthy. Why? Because as I mentioned to you at the very beginning, it does not involve just one system. It involves all of them. The eyes, the neck, the proprioceptor, the cognition, the way you move, the way you stand in space. So it is extremely important that we focus, when we think about aging, also to keep our balance in check. And of course, whenever we have balance problem, we know that the cognition get affected. The same when we have hearing problems, because it's spread all over. So we can have memory problem, memory loss, cognition deficiency, and so on. So one of the other reasons to think about balance. Now, what we can do when we think about aging, what can we do to keep balance, to keep stronger, to age well, not to diminish our risk of falling, will be to train, and to train everything. Personally, I paid my study by being a personal trainer. So I've been in the gym my whole life. I was an athlete before, and I see so many times how trainers are always training in two-dimensional space, just the machine. And actually, this does not promote the vestibular system. So my advice is always to move in a three-dimensional space, maybe dancing, maybe moving, maybe do anything diagonal, anything that trains your proprioceptors, anything that trains the coordination of your eyes, your neck. So those are training that I really suggest all of you to integrate it. Like also just going back to play as when you were a child, when you fall, you roll. These are all things that we forget to do, all of us, but we should keep doing because it really helps. And it shows in fMRI studies, it shows in cognitive tests, it shows in ocular functions when we test the patients through the typical tests that we do, how it can really improve. So the take-home message for today, I hope I didn't make it too medical, it's that personalized medicine is very important. I believe that we should consider gender more, especially when we talk about dizziness. And I really, really hope and encourage everybody to have an holistic approach to health, because it will be fantastic, and to train three-dimensional space so we diminish the risk of falls, and hopefully we're going to be more balanced and healthy. This is my contact if you want to reach out, and yeah, thank you so much for having me. If you have any question, I'm here. Thank you.
Thank you, Dr. Viviana. Thank you very much. Does anyone have any questions? Yes.
Quick question. Are you located in Dubai? Where are you?
So my company is in the US, but we operate everywhere. We have a digital platform, so you can reach us online, and we have doctors and anywhere.
Okay.
So anywhere. Yeah, you can reach us. We can help you anywhere you.
For example, we're told like ADHD and different sensory processings, you know, the vestibular system is underdeveloped. So just in terms of long-term health, you know, the importance now with parents and children, is there a link as well that it is not being developed now at present, you know?
I love this question because I'm just starting a research in Ghent University in Belgium, where we actually study kids with cognitive impairment, ADHD, and we look at the vestibular function and auditory function. So it's a really nice question. So what happens is that when you have children, I mean, the vestibular system is still develops, and it seems to be changing during puberty. Again, because hormones kicks in, and there is a potential changes. We know that some of those kids, they have impairment, but usually, again, it goes by case. I really suggest that if you do have a child that has a severe cognitive deficit, or let's say a different brain structure, that you find somebody that has real functional understanding and all the testing to understand if there is a deficit, and then just work on the deficit, because it might be that there are no deficits. Actually, they might be even better. Sometimes ADHD kids are even better physically than normal kids, let's say. So it really depends. I cannot say, but we are doing a research on that because we are interested in the development of kids and vestibular pathways, because they seem to be different. So let's see. I don't know.
Thank you. No, you're welcome.
Thank you. My question is regarding the elderly. You mentioned in women that it's, you know, the problem happens more often. Is this due to lack of estrogen? And then is the intake of HRT in this case beneficial? Also with regard to migraines, are migraines and the vertigo caused by the same problem as well?
Okay, great question. So, women, what happened? When you have migraine, usually you start to have migraine when you go into puberty, and then it continues. And if you notice, women that get pregnant, they have the so-called pregnancy pose, the benefit of pregnancy. Estrogen are high, progesterone are high. The first 2 trimesters of pregnancy, no migraine. So this is beautifully shows the correlation between hormones and migraine. And when estrogens are low, so there is the so-called estrogen withdrawal, migraine attacks come back. So if you're a woman and you suffer from migraine, you probably have higher attacks during menses or just before menses, so before your period. So when you enter menopause, the beauty is the migraine leaves you most of the time because the estrogen and the progesterone fluctuation stops. So the only good thing of pregnancy, migraine stops. Now, when you go into menopause, is that it stops. But if you have never got migraine, but let's say you go into menopause and sadly you develop osteopenia osteoporosis, it is possible that you also develop some sorts of vertigo, like, for example, BPPV, which is very common. And it's very panicking because when it happens, usually you lose so much the sense of balance, you start vomiting. If you ever seen this type of patients, they get really panicking. But the maneuver that it's applied is very simple. And usually you tilt their head and you restore the otoconia back in the place where it should be. The treatment is non-invasive, very simple, no medications, and they restore. But again, the source, the primary etiology, the cause, is that they are osteopenia osteoporosis. So somebody should work by advising them to get vitamin D, to try to work on that problem because that will fix the recurrent happening of vertigo. So hormones plays a role, of course, and in general, we as women were more prone to many diseases. So this is our beauty and curse.
Thank you. We have another question here.
Just a quick one. This is, I understand, perimenopause, menopausal woman, you check the hormone, you have holistic approach. What about young men? Most of the patients we have here, young men, healthy, they have tinnitus or vestibular problems. So what's your holistic approach about young men?
About grown men. Grown, you said. Old men.
Young men.
Young men. Oh, yeah. I mean, of course, we also have men. Tinnitus is different. Tinnitus is so common. I personally love neuromodulation to help tinnitus. Also in men, it works very well. In my research, I have published a few papers about men that sometimes have also had low estrogen. Low testosterone, and also, I mean, there are men, there are many men that can have also dizziness. But if you look at the statistics, 80% of some of the pathology that I've mentioned are more women than men. Of course, we also have men. And for men, apart in some I published one paper only where I tested men and they had low estrogen. Most of the other time, there is no real explanation. In Meniere disease, we know that there is a genetic component. So if the man has this genetic component, maybe that's why he developed the dizziness. But again, we don't know why certain men get it and they don't get it. So my suggestion will be that if you have more male patients, to anyway use the holistic approach because it can help them. So again, advise them on changing their lifestyle, advise them on checking their genetic plan, and advise them on looking at the endocrine profile. Some men, they play, with neurosteroids, so it depends.
Okay, thank you very much. May I please have a gratitude clap for Dr. Vivian? Amazing.